Hello, I'm Dr. Rohini. So today I'm going to talk to you about one of the very important investigation that is required for treating a couple with infertility. Till now we have spoken a lot about female infertility, investigations required for the female. Today I'm going to talk about the male counterpart. So the basic investigation that is required to rule out male infertility is a semen analysis. So now, today I'll tell you what are the parameters that we do in a basic semen analysis, we check in an analysis, and also what are the criteria for giving the test. So first of all, to give the test, it's important that the patient maintains at least 3 to 5 days of abstinence. There should be, that is, 3 days of gap after the last intercourse or after the last ejaculation. We expect the sample to be given in the clinic or the infertility clinic. Usually we have made provisions in such a way that the andrology lab is very next to the sample collection room. But a lot of patients feel little hesitant to give sample in the infertility clinic. For them, we do make exceptions. If their house is within 15 minutes limit from the lab, we make sometimes exceptions that they can collect the sample from home and come back. But we also warn them in advance that temperature of the semen sample has to be maintained. So if in case they are bringing from home, if it is more than 15 minutes, or if the temperature is not maintained, that it might affect the final results of the test. Usually we give a clean container to the patient, and we provide a clean room where patient doesn't feel very stressed out, and immediately after the collection of the sample, we start processing it. When you're coming to give the test, you should be in a very relaxed mind. You should not be stressed out, because what we have seen is sometimes patient will come from far off places, they will travel in between work, and they'll try to come and give a sample. They will not be able to provide us with the sample. So it's very important that you are very mentally relaxed when you come. And in case if you're not able to give the sample, there's no problem, you can give it to on the subsequent day. And also there are certain medications that we will give you in case that doesn't happen. But again, it's very important that you're very relaxed when you come to the lab. And also there are certain situations when, if the patient has recently suffered from any fever or any other disease like typhoid, malaria or dengue, we tell the patient to avoid giving sample or testing his semen parameters for the next 1 month, because all these diseases or fevers, they reduce the sperm production in the upcoming month. So in that case, we can give a break and again do it. So now next, and also we have to find out what medications patient has been taking, because certain medications also hamper with the test results. Now, other than that, now I'll talk to you what are the parameters that we see in the semen analysis testing. So in the semen analysis, first we see certain parameters. First of all, we see the volume, the total count, and the sperm concentration per million, the total motility, and active motility, and the morphology. So I'll just tell you what are the expected cutoffs. So the volume should be at more than 1.5 ml, and the total count should be more than 39 million, and the sperm concentration should be more than 15. Total motility, that is the active motility, should be more than 32%, total motility more than 40%, and morphology more than 4%. As you can understand, the sperm concentration is per million how many sperms are present. So based on this, we can, if the sperm concentration is less than 15 million, then we call it as oligospermia. That is also again graded into mild, moderate and severe. If it is 10 to 15, it's called mild, 5 to 10 is moderate, and less than 5 million is severe oligospermia. And then when it comes to motility, we just don't concentrate on total motility, because what we want is a forwardly moving active sperms, so that it can travel in the female genital tract and reach the tubes and fertilize the eggs. So the active motility is very important. So that should be more than 32%. Now, it's not just enough that we have counts, that the count of the sperm is normal, and if the motility is normal, that is the speed of the sperm is normal, it's also important that the shape of the sperm is normal, because an abnormal sperm, if it goes and fertilizes the egg, there will be no implantation, or even if the implantation happens, we have noticed that when abnormal sperms are there, the patient tends to have abortion in the 4 to 6 weeks, even if the implantation happens. So it's very important that the sperm shape should also be normal. So that's the morphology, which should be more than 4%. Other than that, there are other tests that we do. Along with it, we see fructose positivity. That gives an idea of if there is any obstruction or blockage in the genital tract, in the ejaculatory duct. Other than that, we also see the number of pus cells in the sperm. That gives an idea if there is any infection in the sperm, because that also affects fertilization capacity of the sperm with the egg. So in case if there is any infection, there are more pus cells, then we give a course of antibiotics for at least 10 to 14 days to the patient. And there are some additional tests which we can request to the andrology lab, like semen culture sensitivity, where again we will find out if there is infection, we'll find out what kind of organism is causing this infection. Other than this, there's also a test called Semen DNA Fragmentation Index. This is a slightly advanced test which we don't usually do for all the patients. There are certain situations where we do. For example, when the patient has history of repeated pregnancy losses, or in case if during an IVF there is history of previous fertilization failure. So this is a slightly advanced test. I'll talk about these tests in my further episodes. So with this, I will conclude now today's video. In our next episode, I will talk to you about what are the abnormal parameters and how do we grade an abnormal semen analysis, and what to do next if you get an abnormal result.